Welcome to the Maternity Mentor. Today we will be talking about why you should consider getting your Tdap vaccine while pregnant, some of the risks associated with not getting it, and some of the myths and misconceptions you may have heard about the Tdap vaccine. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC. I am maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Tdap vaccine is recommended to pregnant women every day, yet most women don't understand why it's being recommended or whether it's safe to take. Let's explore what the Tdap vaccine is about and why you should consider getting vaccinated. Tdap is an acronym used for the tetanus, diphtheria, pertussis vaccine. Tetanus is a bacterial disease that is often found in soil and animal waste. It gets into the body through a cut or open wound. If you get tetanus, it might cause muscle tightness and painful muscle spasms. If you're not vaccinated and contract tetanus, 10 to 20% of people will die from the disease, even if they have received high-quality medical care. Diphtheria is another bacterial infection that causes a fever and sore throat. As the disease progresses, a thin membrane or layer can form over the back of the throat and airways, making it difficult to breathe. Diphtheria can often be deadly if no treatment is received. Finally, pertussis is another bacterial infection that starts out like the common cold. People can develop severe coughing in the weeks to come. Pertussis is often referred to as whooping cough. This is because the severe cough can be fast and heavy with a high-pitched whooping sound when breathing in. Risk factors of whooping cough for children and adults include either not being vaccinated or having the vaccine wear off. For infants under 1 year, the primary risk factor is not being vaccinated or not completing the vaccine series. However, infants under age 2 months are not even eligible for the vaccine and have the highest risk of complications. Complications for infants under 6 months of age who contract whooping cough are serious and include slowed or stopped breathing, pneumonia, dehydration due to feeding difficulties, weight loss due to feeding difficulties, seizures, brain damage, and even death. Most babies and toddlers who contract whooping cough require treatment in the hospital. Signs and symptoms of whooping cough take about 7 to 10 days to appear, but can sometimes take longer. Symptoms are mild in the beginning and can include nasal congestion, runny nose, fever, red watery eyes, and cough. The symptoms often seem like a regular common cold. After a week or two, symptoms will start to worsen. Thickened mucus can accumulate inside the airways. This leads to difficulty breathing and uncontrollable coughing. These severe prolonged attacks may cause excessive fatigue, they may cause vomiting, they may cause redness or blueness in the face, and they may cause a high-pitched whooping sound during the next breath of air. Infants, however, do not always cough. They can struggle to breathe. They may also experience apnea, which is when they temporarily stop breathing. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about Tdap vaccine and pregnancy. Unlike the flu, there is no season for whooping cough. Whooping cough or pertussis is endemic or found regularly in communities all over the United States. The current recommendation by the American College of Obstetricians and Gynecologists, or ACOG, and the Centers for Disease Control, or CDC, is that all pregnant patients should receive the Tdap vaccine during pregnancy. Ideally, the vaccine should be given as early as possible within the recommended window of time, which is 27 to 36 weeks gestation. When a woman receives the vaccine while pregnant, her body starts to make antibodies to the disease. Protective antibodies peak around 2 weeks after the vaccination has been received. However, it does take time for the antibodies to pass through the placenta to the baby. So the earlier a woman receives the vaccine during pregnancy, the more time a baby has to build the same antibodies in their system. A baby whose mother receives the vaccine early in pregnancy has a 78% reduction in developing whooping cough by age 2 months. A woman who gets vaccinated during pregnancy will also pass antibodies onto her baby while breastfeeding once her milk comes in. However, this will only occur if the mother is vaccinated at least 2 weeks prior to delivery to allow for enough antibodies to be produced by her immune system. If a woman does not receive the vaccine during pregnancy, she should receive it as soon as she delivers. This protects her from contracting the disease and passing it to her baby. It is also recommended that partners, family members, and caregivers also receive the Tdap vaccine for the same reasons, so they don't contract the disease and pass it on to the baby. The recommended time to receive the vaccine for partners, family members, and caregivers is at least 2 weeks before the baby arrives. If the Tdap vaccine is indicated due to a wound prior to the recommended window, a Tdap vaccine should still be given to the pregnant mother. Additionally, if a mother receives the vaccine early in the pregnancy, for example at 27 weeks, she does not need to be vaccinated again during the same pregnancy. However, it is recommended to be revaccinated during every pregnancy because there is no blood test to show whether a person still has immunity. The Tdap vaccine is safe during pregnancy and approved by the CDC and ACOG. Side effects of getting a Tdap vaccine are very mild. They usually only last 1 or 2 days and are far safer than contracting the whooping cough itself or your infant developing whooping cough. Side effects include redness, swelling, or pain at the injection site, headaches, body aches, nausea, mild fever, fatigue, and chills. Tdap vaccines rarely cause serious side effects or reactions. These reactions can include severe pain, bleeding, or fainting. The first myth is that whooping cough is a disease that only affects children. In fact, adults contract whooping cough all the time and sometimes don't even know it. This is important because you can contract whooping cough and pass it to your vulnerable newborn. The second myth is that Tdap vaccine gives lifetime immunity. This has simply been proven to not be true. Therefore, it's so important for women to receive the vaccine with each pregnancy. Third, coughing is a sign that a person is contagious. This is also not true. Some adults and children never develop a cough with whooping cough and can still have serious disease and be contagious to others. Finally, Tdap vaccine causes birth defects or pregnancy complications. Non-infectious vaccines, including Tdap, have not been shown to cause pregnancy complications or birth defects. This includes miscarriage, preeclampsia, preterm delivery, and stillbirths. Additionally, there is no further risk of complications to babies during the newborn period when their mother receives the Tdap vaccine during pregnancy. The Tdap vaccine is a safe vaccine that can prevent serious complications and illness for your newborn. I hope this has explained the benefits and safety of the Tdap vaccine and given you the information you need to consider vaccination. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.